Hello everyone. So today we will evaluate an ECG of a patient. So before diving into what ECG shows, I would like you to note some things, that this is an ECG where the paper speed has been increased. So whenever the paper is increased, the standard paper speed is 25 millimeter per second, and whenever the paper speed is increased to 50 millimeter per second, the RR interval and every interval usually doubles up. So if it is normally 3 squares, it looks like 4 square, it looks like 6 squares. So if a patient shows you this ECG, and if you are not assessing it nicely, then what you will do is that you will see this part of the ECG and think it's a ventricular tachycardia, fibrillation or Torsades kinds of thing, right? But what we should always do is that we should correlate all the leads. Now you see in this same part of the ECG, from here to here, the rhythm strip is showing a normal sinus rhythm. So what is this then? This is artifact. Now if you correlate from one point to another point, you will see that there is a QRS complex niche which is matching up. So this is an artifact. This is not a VT. Maybe the patient has moved his limbs, so upper limbs usually, because the artifact is more concentrated in the AVL and in AVR part than on the other leads. So this can happen normally, and if you see such an ECG, it is always important that you correlate the patient's hemodynamics, because if a patient with a sinus rhythm suddenly develops VT, patient will develop some symptom in most of the cases, like hypotension or giddiness or palpitation, or maybe loss of consciousness. But if the patient is hemodynamically stable, his vitals are stable, and you find this ECG and you see that it is not correlating with other parts of the strip, and there is a QRS complex that can be documented in the artifacts, so you should always reconsider your plan of management and not run into shock or giving amiodarone. Rather than, you should repeat the ECG or reset the leads attached to the patient. Thank you.